And a short time ago, I spoke to Professor Neil Quigley, Vice-Chancellor at the University of Waikato, about those very numbers and whether plans had been downscaled.
No, it's just that we've been through a process where we went from an outer limit of what it could possibly cost based on very high-level estimates down to working through a detailed cost analysis and coming up with the numbers where we've ended up for now.
So no changes to the construction of the facility have changed. That $150 million was just saved in looking at the numbers a bit closer.
Well, what's been saved is that there's a lot of spare capacity because of our shortage of doctors around the country. So where we initially thought we might have to build all of the space we needed new from scratch, we now find that we don't have to do that. So that's one area of material saving.
Are you talking about those areas in the rural communities? Are you saying that you don't need to build that teaching space because we simply don't have the doctors in those areas?
And in community medical centres, in the rural and regional hospitals, there is space that we can utilise because at the moment they have spare space, yes.
How much money is the university putting towards this?
Well, what we've said is that we'll put in $150 million and we expect that $150 million might be roughly evenly split between philanthropic support from people in the community and money that comes from the university's operating position.
So do you have pledges from individuals?
We do, yes.
And that equals, what, $75 million at this stage, does it?
Not yet, but heading in that direction. We have a substantial amount of that already pledged, but as you'll understand, those pledges are conditional on the fact that we needed approval to actually build the medical school. So there's still some process to go through in pulling all of that together. So
how much money has been pledged?
Well, I can't tell you exactly what that is for the reasons I've just explained.
Okay, and what if that money doesn't come through? Will the university be making up the $150?
Well, I'm sure that the money will come through and yes, the university has the financial scope to actually fund the medical school if it needs to. We're in very good financial shape at the moment. We have a substantial unused ability to borrow and so we think that it's a straightforward proposition.
So why not just pay the whole $235 million from the university then?
Because there's very substantial benefit to New Zealand and to the taxpayers of this country from the project, and so a commitment from the government as well seems reasonable.
Okay, very quickly, I just want to go over the enrolment process briefly. This medical school will have a focus on rural training. How will you make sure that these students enrolled in this program will stay in those rural areas after the training?
What all the international literature says is that you need to select students that have a background in rural and provincial areas, and then you need to get them to commit to most of their training taking place in those areas. So our program involves only 1 year full-time in Hamilton, and then the remaining 3 years based primarily in clinical placements back in the regions where the students have come from.